Alcohols are the most frequently used inhalant solvents, methanol, ethanol, and isopropanol. Ethanol, of course, is the stuff you drink. If you drink methanol, you go blind. It has an affinity for the optic nerve, and it will destroy the optic nerve. Isopropanol is the stuff when you go into the hospital and they decide they're going to give you a shot, they rub your arm down with alcohol, it's isopropanol. So there you go. Can you drink it? No. I don't think you'd want to. When inhaled, alcohols can produce a mild high along with nausea, vertigo, weakness, vomiting, headaches, abdominal cramping. I worked in medicine for 30 years. Sometimes we were knee deep in isopropanol. I never got high, I never got sick, I never vomited or had abdominal cramps, but then again I was pretty used to it by that time. For ER personnel, it is important to know the warning signs of solvent abuse. We get these people coming into the emergency room all the time. They've got something to complain about, so we need to deal with that. So you need to know, and of course all this looks like the flu. Everything looks like the flu. Headaches, chemical odor on the body or clothes, usually, and people don't realize this. If you've been, wherever you've been, that smell comes with you. If you fried bacon for supper, that smell comes with you. So whatever you bring into the emergency room, we know exactly where you've been and what you've been doing. If you just filled up with gasoline, your clothes will smell like gasoline. It really doesn't matter. You can lie to us all day long. If you've been to a bar, we know you've been to a bar because you smell like alcohol and tobacco. Well, that's the old days, of course. Now they're not allowed to smoke in bars. But in the old days, if they had been to a bar and they said that they were walking in the park and they smelled like tobacco and alcohol, we knew that they were lying to us. So the chemical odors that will come off your body, and the odd thing is, and I've had this situation, I've been in this situation before, nurses a lot of times will not smell things. Nurses will cancel that part out. They don't register what they're smelling. I had a situation one time, they asked me to come in and draw a little boy, a 7-year-old. They thought that he had gotten into something, he was poisoned or something. And when I went in to draw his blood, and I got close to him, I could smell that he smelled like a brewery. He smelled like beer. And I drew the kid's blood and went out and talked to the nurses about it. And the nurses said, no, that's the dad. The dad smells strong. And I said, no, this is the kid. He smells like alcohol. Go in and sniff his breath. You know, that kind of thing. And of course they didn't want to do it. And we got into a big argument. They're saying it's the dad. And I'm saying, I think that kid's snottered. And of course, eventually the doctor went in there and got close enough to the kid that he smelled it too. All they needed to do was, flip that switch in their brain and start acknowledging what odors they were coming in contact with, and they were able to smell what the kid actually smelled like. And it turned out the kid had gotten into his dad's beer and had drunk a whole 6-pack. Then the father had come home, and of course the kid drank up all of his beer. So the father came home, and he hadn't had anything to drink. But everybody, when they went into the room and they smelled alcohol, they assumed it was the father. It wasn't that funny. The kid almost poisoned himself. He had drank so much alcohol. So the chemical odor on the body or the clothes. Red, glassy, or watery eyes with dilated pupils. Of course, we see this with a lot of different things. Nosebleeds, inflamed nose, rashes around the nose or mouth. This is an indicator that something's been going on. They've been doing something. They've irritated the skin around their nose and their mouth, and this can indicate that something's going on. Slow, thick, slurred speech. Of course, we see that with any type of inebriation. Staggering gait, disorientation, lack of coordination. We see that with any inebriation again. Pains in the chest and stomach. Fatigue, nausea, shortness of breath, loss of appetite, intoxication, irritability and aggression, seizure and coma. Could be the flu, could be just about anything. Could be viral infection, could be a bacterial infection, could be a fungal infection. All of this stuff looks the same, and this is one of the reasons why you need to go around sniffing people. As horrible as that sounds, it's one of the things that you pretty much have to do. We're going to talk about volatile nitrites. There is a sexual component to this. I apologize for that, but we see this from time to time. People think that, oh good, I'm going to have a good time, and then all of a sudden they overdose themselves, and then they come into the emergency room, or they think that they're dead. It gets really weird at this point. But there is a sexual component to it, and I apologize before we get started. Now you know. Now you know that this is one of the things that people do in order to have interesting sex. Nitrites have been used as medicines, especially heart stimulators, because of angina. Angina is pain. Angina just means pain, but we're talking about angina pectoris, which is pain in the chest. Since we've been using this stuff since the 19th century, there's alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite. So there's a lot of nitrites out there, and they're all used in medicine. They all can be used in medicine. They're also used in cooking, which is a little weird. Nitrites dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning, because cyanide tries to close your system down, so we'll give you one of the nitrites in order to, nitroglycerin is a good one, to open everything up, to open up your chest cavity more, to open up the blood vessels in your chest. When I had my heart attack, they kept putting nitroglycerin under my tongue. It only lasts for about 90 seconds. It doesn't last for a long time unless they put a patch on your arm with nitroglycerin in it. It takes 7 to 10 seconds for the effects to take place, and it lasts for only 60 to 70 seconds. The blood pressure lowers and it hits its apogee at 30 seconds and returns to normal at about 90 seconds. So if you've got angina pectoris, you've got a hiatal hernia or whatever, and your chest hurts, they'll put one of these things under your tongue. A lot of times you've got two problems. First problem is you've got your blood vessels are closing down, but the other problem is that you're responding to it. And the reason you're responding to it, your muscles are all tightening up. So what we do is we give you this nitroglycerin, and usually it not only takes the pain away, but it also allows you to relax. Once you relax, a lot of times the pain will go away. Nitrites are sometimes called poppers. Of course, that's not in the hospital. We don't call them poppers in the hospital. They call them poppers out on the street. So if you're looking for a good time, you ask somebody for a popper. Nitrites cause a feeling of fullness in the head. You do get a bit of a rush. Mild euphoria, dizziness, and giddiness. Of course, I'm giddy most of the time, so they couldn't really tell. As the inhalant burns off, you might experience headaches, nausea, vomiting, and chill. As I told, who was I talking? Oh, Don Robinson. You guys know Don? Don Robinson has chronic headaches. I've never had a headache in my life. I've been hit in the head with a baseball, with a softball, and I still didn't get a headache. And here Don has headaches all the time. Ha ha ha. So I laugh at him every time I see him. Which usually relieves his headache. Excessive abuse may cause oxygen deprivation, fainting or passing out, and temporary asphyxiation. We haven't gotten into the sexual aspect of it, but these three things you need to remember. This is the reason that they keep coming into the emergency room. Oxygen deprivation, they faint, and they have temporary asphyxiation where they can't catch their breath. Overdoses do occur and necessitate taking the victim away from the nitrite. Okay, well, and of course this has to do with sex. So they start using this stuff, they start having sex, and all of a sudden they pass out. Well, that doesn't look very good for anybody. So one of the things that they have that you have to do is pull the nitrite. But of course, there's sexual activity going on, so sometimes that doesn't happen. So you get this dead person laying there on the whatever. And at this point, of course, you need to do something about it. You need to take the nitrite away from them. CPR might be necessary to maintain heart rhythm and respiration. This is what we need to do. Chronic users will have a reduced oxygen carrying capacity due to methahemoglobinemia. So they destroyed some of their red cells, which is always fun. Nitrites are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. And this is normally the reason that it's used. It's used for anal intercourse. So it's used in some gay intercourse can be used for heterosexual intercourse, of course, but it's also used for homosexual intercourse. And this is usually where we came involved, where we got involved. It wasn't usually a guy and a girl that she passed out because he was shooting poppers in her nose. It was because of two individuals were having gay sex, and the receptor was the one that had passed out. And sometimes it looks like they're dead. Usually they're not. They don't usually die from this stuff. You know, your sexual response is not as important as life and death. Usually, for most people anyway. And normally they stop before he dies, or she dies, whichever the case may be. Unfortunately, nitrites impair the immune system by inhibiting the functioning of white cells. Nitrites also convert nitrosamines, which are cancer-causing chemicals. And of course, this is down the road. This is something that you don't have to worry about. Okay. Okay, so we got this old guy, and he wants to have sex with somebody, or somebody wants to have sex with him. So he takes a Viagra. Viagra lowers your blood pressure. Well, poppers do the same thing. And unfortunately, you mix the two of them together, and now we've got a doubly lowered blood pressure. So sometimes they pass out, and usually this is what happens. People are using, this is so weird. Viagra is for erectile dysfunction. It's for guys that have a problem with erections. But kids are using this stuff. I mean, young men are using this stuff to prolong their erections, I'm assuming. So this stuff is all over the place, and it's being used. What it does, it lowers your blood pressure. And of course, sometimes you get a reaction. You get a negative reaction from it. So if you mix the poppers with Viagra, all of a sudden you got a doubly lowered blood pressure, and now potentially the individual's going to pass out, and maybe his heart will stop beating. So you have to keep him going. Weirdly enough, sometimes they'll use poppers with Viagra, which lowers your blood pressure amazingly, and then they take methamphetamine to give them more of a sexual reaction. People have been known, of course, to faint or even die when they take all three of these drugs at the same time. Well, this can be a problem, a real serious problem. Volatile, and this is why they come into the emergency room. Usually they passed out during sex. Somebody calls the fire department. They send out their first responders. The guy's not breathing. They start doing CPR on him. Usually they come back. I've never seen one of these guys die. We had a large gay population when I was working in Omaha. And actually it wasn't in Omaha, it was Lincoln that had a large gay population. But these guys would come into Omaha for a party or something. You know, we get 2 or 3 of these guys a night, which is always fun. Volatile nitrite abusers are notorious for multiple drug use, and of course, if you're using Viagra, one of the nitrites and methamphetamine, that's a multi-drug usage. Methamphetamines, of course, are illegal. Methamphetamine is real popular in the gay population. They use a lot. Marijuana is the #1 drug, and number 2 is methamphetamine, because it has a sexual response to it. 2/3 use at least 3 or more inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. You can imagine what happens if you're mixing methamphetamines, poppers, Viagra, and drinking tequila. You can imagine what kind of horrible responses you're going to get, or the potential negative responses you're going to get. Anyway, you guys are never going to have to worry about this. You're never going to have to work in an emergency room where these guys come in, and they only come in on Friday nights. I don't know why. It's always Friday night. Hated working Friday nights, especially if it was a full moon. I don't know what that has to do with anything. I'm sure it has nothing to do with anything, but a full moon, achievement, Christmas, these guys are coming out of the woodwork.
I have a relative that works in group home care, especially with drug addicts. Most kind of sent to Puritan, big city. These are the stuff that they look for too.
Sure.
Usually the ones that come in, and some of them are repeaters, and some of them are just, filling in space. At the same time, they're getting off the chemicals.
Right.
More often, they give them like a little slack where they can go find a job or go back to school.
Sure.
But when they come back home to their group home, they start kind of like observing
You make sure they haven't been.
Yes, and sometimes they fall off that wagon.
Of course they do. Especially on a full moon night. One of the great things about a full moon, you can walk around and it's not dark outside. So a lot of people do all kinds of crazy stuff on full moon nights. I don't know why. Makes people howl at the moon. Haven't figured it out yet. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was nitrous oxide. Of course, that's laughing gas. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects that people have. Nitrous oxide is a solid it's sold in small plastic containers. It's not a solid, it's a gas. It's plastic containers to be used in cooking. And of course, if you've ever been around a kitchen where there's a chef and a sous chef and whatnot, head chef and a sous chef, and then all those people on the line, a lot of these individuals are drug abusers. My son went to Le Cordon Bleu in Pasadena, so he's a chef. So he started working in the kitchen, and he couldn't handle it because all these people were stoners. I mean, they were all just crazy. A lot of methamphetamines. You got to get everything out really fast. So they'd smoke methamphetamines, or they would inject it or whatever. And then they had to shave all the hair off their bodies. So all these guys are on the line, and they've got bald heads, and they've got no hair on their arms and whatnot because they've shaved themselves because they can't stand it. Methamphetamine makes you do that. Makes you need to do that. Anyway, so he got out of it. He couldn't take it with all those idiots dropping all this stuff, and nitrous oxide is one of the things. I mean, they have to lock it up. The chef has to lock it up. Otherwise they just snort it all night long, and for a high, I guess. Nitrous oxide's effects include dizziness, giddiness, and disorientation. Silly laughter. You laugh about just about anything. Now you would think that this laughter would make you non-aggressive, but it's the very opposite actually. Buzzing and throbbing in the ears, visual hallucinations, confusion and headache, Feeling that one is about to pass out, impaired motor skills and fainting. That's what happens with nitrous oxide if you get too much of it. It also makes you somewhat aggressive, so that's a problem. So you're laughing and punching people at the same time. Effects only last for 2 to 3 minutes. Cognitive functioning is impaired with the drug, but it returns to normal after about 5 minutes. So the stuff burns off fairly quickly. Long-term exposure can cause peripheral and central nerve cell damage due to a lack of oxygen. Nitrous oxide replaces oxygen in the blood, and this isn't good. If you're one of those individuals that can't tolerate Novocaine, so you have to have your dental work done with nitrous oxide, this can be a problem if this lasts for an extended length of time. Nitrous oxide replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and legs, cardiac arrhythmias, asphyxia, seizures, and of course death if you're not careful. Halothane is rarely used in the West. It's very common in third world countries. It's because it's fairly inexpensive and it works fairly rapidly. This anesthetic is used primarily in veterinary procedures. It's most frequently abused by hospital personnel because they have access to it, of course. Halothane. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross-tolerance to other depressants, especially alcohol if used chronically, and of course this can be a problem. If you're drinking and using inhalants, a lot of times it's a deadly mixture. It can be a deadly mixture. I'm reading a novel right now about Iceland. Iceland? Oh, everybody wants to go to Iceland. Iceland has a really serious problem with alcohol. They drink a lot, okay. And they drink really weird stuff. They don't drink beer. They drink vodka. They drink the almost pure alcohols, and they drink a lot of things that are mixed with things. But they also use inhalants at the same time, which can be a deadly mixture. Anyway, I'm about 2/3 of the way, or 1/3 of the way through the book, and we've already had 2 people that have died from drinking methylated spirits, which is it's supposed to be some kind of an extract, like vanilla extract, that kind of stuff. And they used some kind of an inhalant that killed them, and so they've already had 2 deaths. It's a murder mystery, so they think that somebody's giving them the bad inhalants at this point. Anyway, kind of fun. Don't mix your alcohol with an inhalant. Inhalants are seen as low class among the drug-using community. You can find it in any garage, so this isn't stuff that you have to buy, and it's not very high class. 3 categories of drugs are used in sports. Therapeutic drugs used for specific medical problems and administered through proper medical supervision. Things like analgesics, muscle relaxants, anti-inflammatory, and asthma medication. This always comes up during the Olympics because asthma medication is one of those things. A lot of people have asthma. A lot of athletes have cold air contact asthma. For that reason, they take asthma medication. Well, most of the asthma medications are PEDs. They're performance-enhancing drugs, and we're going to talk about that in just a minute. So there's only a select amount of this stuff that you can have in your system to be legal as far as the Olympics are concerned. There's ergogenic drugs. These are performance-enhancing drugs. Steroids, obviously. Human growth hormone has become huge in professional athletics, especially football, where it's not illegal. But it is illegal for baseball players to use human growth hormone. Ryan Braun of the Milwaukee Brewers won the MVP a couple of years ago, and he had to sit out the first 60 games of the next season because they had found human growth hormone in his system. So potentially he cheated when he won the MVP. I couldn't understand why they didn't take it away from him, but they didn't. Bicycle riders, cyclists will do blood doping. Gives them more oxygen carrying capacity so they have more stamina. And of course you can use stimulants. Baseball has had lots and lots and lots of problems over the years. It seems like they have always had one scandal after the other dealing with alcohol back in the beginning of the 20th century. In the 1970s and 1980s, everybody was using speed. They were using stimulants. And of course, we're going to talk about that in just a minute. And then later on, of course, steroids, and now human growth hormone. Anytime you can cheat, and if you're a professional athlete, anytime you can cheat, it seems like some people actually will. Recreational and mood-altering drugs are the third type of sports drugs. Athletes use drugs because they perceive drugs as a quick way to put on pounds of muscle. It increases your stamina to get up for a game. Of course, if you're playing every day, if you're a baseball player, this is baseball season, so these individuals play every day. So they have to get up, every day they have to get up for a game. Every day they have to put out 100% in order to win the game. So you have to get up for the game. It's tough. NBA, of course, they don't play every day. Usually they don't play every day. Every once in a while they'll play back-to-back games, but they'll play 2 or 3 times a week. Get up for a game. Relieve pain, of course, to keep up with the other athletes who use drugs. And this was a really serious problem in the 90s and the beginning of the 21st century. We had Mark McGwire that was hitting home runs all over the place. We had Sammy Sosa was cranking home runs out of Wrigley Field. And then we had Barry Bonds, who seemed to be able to hit the ball farther than anybody had ever seen. Now, why in the world would they do that? Well, as it turned out, they started checking to see if people had steroids. Now, they never found Barry Bonds with steroids in his system. Mark McGwire, they found the drugs that he was using in his locker. Sammy Sosa potentially was using steroids. But so then they started checking all baseball players, and guess who they caught with more steroids than anybody else? It was the pitchers. 2/3 of all the people that they caught using steroids were pitchers. And of course, if you know anything about baseball, people used to throw 90, 91, 92 miles an hour. Now everybody's throwing 100 miles an hour. And they're throwing so hard they're destroying your elbows. And they have to have Tommy John surgery. And this is happening over and over and over and over and over again. So the pitchers were using steroids. And the hitters, in order to keep up with the pitchers, were using steroids as well. So, or if you're a running back and the linebacker is big as a truck, in order for you to protect yourself, you've got to use steroids just like he does. So they were using steroids to protect themselves from the other players. Analgesics and anesthetics are used to deaden pain and include both topicals and orals. The topicals include alcohol, ethanol, and methanol, procaine and lidocaine. If you've ever had any kind of surgery that's just under the surface of the skin, usually they do not knock you out for that. They will inject lidocaine or procaine or one of the cocaines into your skin so that you can't feel it. We were talking about this last night. Oh, I was talking to my son last night. His fiance has a basal cell carcinoma on her forehead, right below her hairline, and she has to have it taken off. And they said it was going to be a 4 to 5 hour surgery, and I was thinking, geez, I had one cut off my forehead. It took like 5 minutes to cut it off, but he just injected around the site, and then he just cut it out, chopped it out. I had another one taken off my face, over here on one of my cheeks. That's the cutest thing. So the funny thing was, so he cuts this thing out, and then he says, "I'll be back in a minute." And so I go up and I look in the mirror, and I got this god-awful gash across my, I mean, it was, well, it wasn't that big, but it was pretty big. It was about this large. I mean, it was crazy. This huge gash across my cheek. So then he pulled it all together and sewed it back together. Anyway, you can hardly see it. I don't scar very well, which is a sad, sad thing. Anyway, you can use lidocaine or Procaine. Oral, taking things orally, aspirin, ibuprofen, acetaminophen, Vicodin, Demerol, morphine, codeine, propoxyphene, also known as Darvon. Darvon is a mixture of, usually it's an opiate and acetaminophen. Anyway, all those things you can use, meperidine and hydrocodone. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. So if you decide to go out and run and you got a little pain in your knee, you decide to take ibuprofen so that your knee won't hurt while you're running. Sometimes that's not a good thing because potentially it'll take the pain away, and now that you're running with, you've changed your gait because it doesn't hurt anymore, and you're injuring your leg more. So that's kind of a danger. Using analgesics before you exercise, not a good idea. It will mask the pain, and you don't know. The pain is there for a reason. Pain tells you, stop doing that stupid.
That's where I had that foot problem with, where the heel part.
Uh-huh.
And I kept going back and getting it checked. They gave me some ibuprofen. And
It works.
So, yeah, but I noticed I went to a therapist, and they told me it was just, you just need to put more muscle into it, just keep doing all these exercises like stair tracks and like this to your feet.
Right. Like a cat.
Yeah.
Needy. Yeah.
And just stretching on your calves and stuff. So.
Yeah, this is a hit and a warning. I've been exercising I'm 70, so I've been exercising for 50, 60 years. I've been lifting weights for 50 years. I never, ever take anything. I never take anything before I exercise. Some people do, and then they blow something up because they don't have the pain isn't there to tell them to stop, so they don't know. I never go out on the field with analgesics in my system. I hardly ever take analgesics. I can't take any analgesics anymore. I'm allergic to ibuprofen. You don't want to take aspirin. It burns a hole in your gut. And acetaminophen blows your liver out. So I hardly ever take these things. But it's never a good idea to take a painkiller before you exercise. If you're doing that, then you potentially are going to hurt yourself. So be careful. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. Soma and Vanadam, Robaxin, these are both muscle relaxants. You can use the benzodiazepines, Valium, will take the pain away, will relax the muscles, Klonopin and Librium. Now sometimes your body is trying to protect itself. So let's say you've got a pain someplace. That pain has started here, and now your muscles are tightening up around it to protect it. That's what's going on. Well, sometimes if you relax those muscles, the pain will go away. The pain's gone. It's already healed. I thought I pulled a muscle the other day, and it hurt. Now, the stupid thing is that I pulled the muscle coming out of my chair in my office. It stood up. Oh my God, I pulled a groin muscle. This is terrible, and I got to run tomorrow. So, if you take something to mask the pain, you never know if it's there or if it's not there. It's not there now, but have I damaged myself? So the next day, that night I slept and thinking to myself, well, I'm going to heal it right now. It's no big deal. And that's exactly what happened. But I didn't take any analgesics to take the pain away, as stupid as that sounds. So sometimes if you can relax the muscle, just take a nap and relax the muscle completely. The tightened muscles will go away, and the pain was just a momentary thing, and now it's gone. But of course, you can worry yourself into damaging yourself if you're not careful, taking a lot of pills and whatever, as stupid as that sounds. But people do those kinds of things. So you can take the benzodiazepines, Valium, Klonopin, and Librium. As I told you before, during Vietnam, the Vietnam War, we had a lot of women that were overly anxious. And one of the things we gave them was Valium to keep them to reduce their anxiety. The other thing we gave them was Librium, which is a muscle relaxant. Which was criminal, but we did it anyway. We gave them a lot of Valium and Librium, and we hooked a lot of women on, especially on Valium. But Librium is a muscle relaxant. It makes you go to sleep, and that's one of the reasons we gave it to them. So they weren't worried. They wouldn't worry about their husbands being shot in Vietnam. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes. NSAIDs and corticosteroids. NSAIDs are non-steroidal anti-inflammatory drugs, also known as NSAIDs. Aspirin, ibuprofen, Indocin, butazolidine, butazolidine, clonoral, and Celebrex. Celebrex is big right now. They've got all kinds of advertisements on television. Celebrex, supposed to take the pain away. It's the best thing you can use. So if the ibuprofen's not taking the pain away, then ask your doctor for Celebrex. I'm kidding. It's pretty strong stuff. But it is on television. It is. The other class of drugs is corticosteroids. Corticosteroids include cortisone. If you've ever had a cortisone injection, which is weird. Has anybody ever had a cortisone injection? Usually they give it to you in a joint because you've got chronic joint pain, so they'll give you a cortisone shot. No? Good. Cortisone it creates scar tissue. That's it. And it does work. I mean, it's scar tissue, and it can work. Problem is that if you've got a problem like I've got a tear in my shoulder and I'm a quarterback and I'm always throwing the ball, they will give me cortisone injections so that I can continue to play. Now, eventually, of course, they're giving me cortisone injections. I'm creating all the scar tissue. You know, it's allowing me to play right now, but in the future, of course, I'm going to have all kinds of interesting problems. And I will develop arthritis if I get too many of those cortisone injections in the same place. Every time I've hurt myself, every time I've had a joint damage, the doctor's always offered me cortisone, and I have always refused, and it's always healed. I'm kind of lucky that way, I guess. But the more cortisone injections you get, the more likely you'll develop arthritis in that area. So you need to be careful. Both types of anti-inflammatories have their problems. NSAIDs, aspirin, and ibuprofen cause ulcers, and they overtax your kidneys. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems, so you need to be careful. Acetaminophen, as I said before, is hard on your liver. Aspirin and ibuprofen are hard on your kidneys. Celebrex is hard on your whole gastrointestinal system, but that's only for people with arthritis. People with arthritis have pain in select joints, and they'll do anything to make the pain go away. Now, the problem with Celebrex is, well, your pain's going to go away as long as you're taking Celebrex, but your Celebrex is really messing up your gastrointestinal system. So which is better? It's like taking a drug that's going to kill you in 10 years, but you're in excruciating pain right now. So which is worse? And there is no answer to that. am I willing to live 10 years, 10 years pain-free for problems in the future? And of course, these are usually questions that doctors aren't asking you. They're just giving you the drugs and not telling you that 10 years down the road, this stuff's going to blow your kidneys out. They're not giving you that information. And this is one of the reasons why the internet is such a wonderful thing. Because now we can read it for ourselves. We don't have to trust our doctor to give us all the information that we need. We can see what the side effects, potential side effects are. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, and psychosis at high doses. So corticosteroids, even though they make you look ripped, there is a price that you have to pay. Asthma medications open air passages. 10% of the general population has some form of asthma. I have bronchitis. It's not really chronic bronchitis. It's cold air contact bronchitis. If I try to run when it's really cold, I can't. I shouldn't. I'll make myself sick. Well, as sick as I get. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. So these athletes can potentially take asthma medications. And as we're going to find, we're going to find out right now. Most asthma medications used by athletes are beta-2 agonists. Clenbuterol, which you can't use if you're an Olympic athlete or any kind of an athlete. You can't use clenbuterol. Albuterol is what is normally used. These medications increase your muscle energy and growth, so you can use them as steroids, in essence. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, erythropoietin. Erythropoietin increases the number of red cells in your body, which increases your stamina, increases the oxygen intake that you can, that your body can utilize. Pre-steroids are things like DHEA. DHEA is a pre-steroid. I take DHEA every day. I took some this morning. Do I look pumped up? It's a pre-steroid. Old people can take DHEA. Doesn't do anything to old people. Well, it makes us young, I guess. It also is a fight stress, which is kind of interesting. But I take DHEA every day. It's getting harder and harder to find. It's outlawed in Ohio. You can't find it in Ohio. Walmart doesn't sell it anymore. No, I have to go overseas to find my DHEA. It's a pre-steroid. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss, as stupid as all those things sound. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia. Some breast cancers respond to corticosteroids, and endometriosis. Your endometrium, of course, is the lining of your uterus. That's the part that sloughs off, the endometrium. My sister died of endometrial cancer, strangely enough. She had a hysterectomy, and when they chopped everything out, I make it sound like they used an axe, hoping they used a scalpel. They missed a chunk of her endometrium, and since it didn't have anything to do, it just kind of became cancerous and started growing, and then she had a tumor in her thorax, which caused all kinds of interesting problems. And eventually she died of endometrial cancer, got into her liver and blew her liver out. When athletes take steroids, they experience increased body weight, lean muscle mass increases, muscular strength increases, stamina, aggressiveness, and confidence. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage, and this is the reason they get so big. People like The Rock, you can tell when he's on steroids, he gets huge. Of course, he's got the body that he can maintain all that muscle mass if he's smart. I had a friend who was a pole vaulter in high school. He was on my track team. He went to Vietnam. When he went to Vietnam, he's a little bitty guy. He's actually shorter than I am. When he went to Vietnam, a lot of people have all kinds of interesting reactions in that kind of a situation. His reaction was to start lifting weights because he was afraid that he thought that if he lifted weights that he would become a Superman. So he started bodybuilding, then he got into powerlifting, started taking steroids. Of course, in the military, nobody cares if you take steroids as long as you don't get too big. If you get too big, it looks like you're fat, and of course, then they'll kick you out of service. So he lifted weights the whole time he was in Vietnam. Came back and he opened a gym, a powerlifting gym, which is different than a bodybuilding gym. Bodybuilding gym has a lot of small weights. Powerlifting gym, these guys are lifting 400 or 500 pounds. They drop a lot of weights. They drop them, so it can't be on cement or you break the weights. Really weird stuff. Anyway, he got big and he kept taking steroids. He has been having problems with strokes. He never had any children. He couldn't have any children because of all the steroids that he took. Reduced his ability to have sex. And at this point he's had all these interesting strokes. He's younger than I am. He's 2 years younger than I am, and he started stroking out in his 50s. Small strokes, little bitty ones, TIAs as it were. Anyway, he's fairly non-functional at this point, and he can't talk. He's lost his ability to talk. Anyway, and that's the price he paid for using steroids. His life has been really kind of strange. Him and his powerlifting gym. I went to his powerlift. I'm a bodybuilder, so from time to time I go home and his gym was right there. So I would go into his gym. But there's nothing. I couldn't do anything. They didn't have the right weights. I mean, all the weights were just way too heavy. I think his dumbbells started at like 75 pounds. So these guys are just lifting masses of weight. The problem with powerlifting, I don't know if you've ever seen a powerlifter, they're fat. They have to put on a lot of connective tissue in order to lift the weights, to protect their joints. So they're big, they're really big people. They tend to be. And this guy was a little bitty, pole vaulter in pretty good shape, and then he became a power lifter, and he just ballooned out. Now he looks like a big round fella. Of course, now that he's not a power lifter anymore, he can't lift anymore. He blew out his elbows, his shoulders he can't do anything, can't lift his arms up, that kind of stuff. Anyway, power lifters. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. If you ever watch weightlifting in the Olympics, some of those guys are really fat. They're just fat guys. Well, they're actually power lifters, and that's why they can lift so much weight. They don't look good at all. I mean, they do have big arms. They have their shoulders, their chest tends to be a little bit sunken, but they've got a big belly because when they bench press, they push air into their stomach, and that supports their lift. Anyway, I don't know why they do it. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids. Now, a lot of these guys don't want to get caught because they can't compete if people know that they're on steroids, so they'll cycle them. They'll cycle the steroids get it out of their system so that they will not be detectable. One of the other things that they do is they take estrogen. They take female hormones. And the female hormones will mask the excessive amount of male hormones that they have in their system. Now, the human body can only tolerate so much of this stuff. We've all got testosterone in our system. That's our sex drive. If you're a male, you have excess amounts of testosterone because of your testicles, which produce the testosterone. It makes us look different than females. Females have a different body shape than males do. Males have more muscle mass. They don't have as much. They don't maintain as much fat, and because of that, and the reason is because of the testosterone. Well, if you're taking extra anabolic steroids, if you're taking extra male hormones, then one of the things that will happen, of course, is that you get more in your system than you need. Now, all of a sudden, the parts of your body that produce testosterone will stop producing testosterone. So if you're a male and you take corticosteroids, your testicles will shrink, and you'll stop producing your own testosterone. And that, of course, makes your testicles shrink. Your penis will get smaller if you're a male. And you can't have sex, as weird as that sounds. So if males are pumping up in order to seduce women, it doesn't work. It's contraindicated. They can't have sex anymore, as weird as that sounds. Immediate effects of steroid use is increased muscle mass and improved muscle tone. Having muscle too large and strong for the bone and tendon structure may cause an overstressing of the muscle. And of course, this ruptures, you can have ruptured tendons and damaged ligaments. We see this a lot in baseball, where people are throwing, where people are running. A lot of times they'll rip the muscle away from their bone. If that happens, you know that the guy's been taking steroids. That you can't do that. That never happens. It never happens unless something is stronger than it's supposed to be. So if I go out and play baseball and I pull a muscle, I haven't torn the muscle, I haven't ruptured my tendons, I haven't pulled the ligaments away from my bones. If that happens, it means I've been using steroids. So anytime you hear that somebody has to have surgery to reattach their muscle to their bone, you know that they've been taking steroids. And this kind of thing happens from time to time. If you don't warm up, of course, there's always a possibility you'll damage something, you'll injure yourself. So these individuals have to warm up a lot in order to keep from ripping something. Baseball players will hit an infield grounder and then they'll rip their muscle away from their bone just running down to first base, because they've been standing in the batter's box for 5 or 10 minutes and they've cooled off. So when they run down to first base, they tear their muscle away from their bone. Pitchers, they're trying to get an extra couple of miles per hour on their fastball, and they tear the bicep away from their shoulder. We know that they've been taking steroids. Of course, nobody says anything about it because those are our heroes, so we don't want to know about our heroes, the negative things about our heroes. I forgot my phone today. How stupid am I? Don't tell my wife. She thinks I love her. So it's 10 o'clock. Okay. Or 10:02 or 10:04. 10:04, okay. So I'm 4 minutes off. All right, thank you. Users often complain of feeling bloated, water retention. Anabolic steroids suppress the natural production of testosterone. If you're a male, you'll have enlarged breasts. Nipple changes. A lot of times, the nipples will shrink. Sometimes you'll get fatty lipomas behind the nipples. So it'll pooch out. Your nipples will pooch out. So it really all depends. Really kind of interesting. Decreased size of sexual organs. I already told you the testicles will shrink. The penis will shrink. Impaired sexual functioning. because you're not producing your own testosterone. And this isn't the type of male hormones that will make you want to have sex. These are corticosteroids. This is not the same stuff. So it's not like you're going to become a sexual maniac. It doesn't work that way. Cystic acne growth. If you look at these individuals, a lot of times when they go to the gym, they will wear a lot of clothes on top. They'll wear long sleeve shirts. They'll be sure to keep everything covered. They never expose any skin. And the reason is because they have acne. A lot of pimples on their backs. It's nasty. Sometimes it will move up into their faces. They'll get them on their chests. It's not very attractive. It's really quite unattractive, as a matter of fact. And this is known as cystic acne growth. The problem is that it doesn't go away, and they just keep getting bigger and bigger. They keep filling up with pus. They fill up with fluid, so they have these god-awful bumps all over their backs and all over their chests, which is always attractive. Thinning hair and more rapid balding, and for this reason, a lot of these individuals will shave their heads. So when you see basketball players, all of a sudden, they had a nice afro yesterday afternoon, and today they've shaved their heads. Potentially, this may be one of the reasons why they're taking steroids, and it's making them go bald. Men, as they get older, they tend to lose their hair anyway, but these individuals will lose all their hair, and they lose it in patches, which is kind of weird. So they'll lose, right above their ear, they will go bald right here, and it looks so strange they have to shave their heads. Okay, female athletes can also take corticosteroids to make themselves pumped up. And it will, unfortunately, it masculinizes them. They are turning themselves into a male because they're taking excessive amounts of male hormone. So they always get attractive. They have increased facial hair, which everybody wants to have a beard. Everybody's looking for a beard. Decreased breast size, which is okay. Who cares how big their breasts are? They get a deep voice. They get a deep voice. And it's kind of one of those voices in between girls and boys. So it's kind of weird. Males have a deep voice because we have Adam's apples, our voice box. We have a larger voice box than females. And the reason you don't have deep voices like we do is because you don't have one of these things. Well, we can increase the amount of male hormone you've got in your system. We can do that and your voice will get deeper, but the problem is you don't have this structure right here, so your voice can't get as deep as a male's voice, but it can lower to in between the male range and the female range, as weird as that sounds. So they'll get a really strange voice. Clitoral enlargement, cystic acne growth, again, usually it's on their back. And they'll go bald, which is always attractive in women. Most of these masculinizing effects are irreversible. So once you got it, it ain't going to go away. Once your face turns into looking like a man's face, it's not going to go back. It's not going to. You're not going to put fat on your cheeks in order and start looking like a girl again. It just doesn't work that way. Once you masculinize, it's all over with. That's what you're going to look like for the rest of your life. I used to lift with a lady who had bigger biceps than I did. She wanted big biceps. And of course, if you work on your biceps, then your deltoids get developed. And so this lady's developing these huge biceps and these nice deltoids. And things were going okay, and then all of a sudden, I guess she wasn't getting big enough, fast enough. So she started dropping steroids. Wow. She didn't look like a girl anymore. She already had these huge arms and she had ripped deltoid muscles, but her face got skinny. She lost all the fat in her cheeks. Her chin didn't get bigger, but it started sticking out more. It was she wasn't attractive after that. It was kind of cool before. I mean, she's building up her biceps. She's got bigger biceps than half the guys. But all of a sudden, she just boyed out. She just looked like, all of a sudden, she looked like a guy. And the guy stopped, it's funny. You go into the gym, if there's a woman in there, you know, the guys are all walking past her, you know, flexing just a little bit, yeah. It's funny. Well, they stopped doing that to her, so it was kind of funny. Or not funny at all. It was tragic. It was tragic. I'm sorry. Did I say funny? I meant tragic. Sometimes I get the two mixed up. Anabolic steroids increase the cholesterol of the user, especially the bad cholesterol, LDL. This is not good because this means you're going to die, okay? So your LDL increases, this is the bad cholesterol, your HDL decreases. So you have these bodybuilders, not Arnold Schwarzenegger, of course, but all the other guys on Muscle Beach lifting all these weights, pumping up to be gigantic individuals, and then they have a heart attack at 32 and die. Why? Well, because they're taking steroids and they have this massive increase of LDL and this decrease of HDL. So now they've reduced their life by a half, maybe 3 times, to be big. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis. They have a lot of blood clots. Just like my friend who's the power lifter, he keeps having these blood clots, and of course, unfortunately, they go into his brain, and he keeps stroking out. Cardiomyopathy. Cardiomyopathy means heart muscle problems. In this case, it's usually an enlarged heart. Your heart's supposed to be a certain size. You can work on your heart. It's a muscle, so you can work that muscle and make it stronger. These individuals are increasing their heart size, and they're making their heart less functional. And of course, they're blowing their heart out and they're dying. Sometimes they die of kidney disease, sometimes they die of cardiomyopathy, sometimes they stroke out, but these guys are dying in their 30s and 40s. Who knows why? Well, we know why they're dying of these diseases, but why in the world do they do this anyway, knowing that it could potentially kill them? Because steroids encourage cell growth, they may equally encourage cancer cell growth. There was a football player, I'm trying to think of his name. If you've ever seen the movie Goonies, he was, I can't remember the guy with the funny face. He was that guy. Well, he's dead. He died of cancer. He had a brain tumor. And the reason he had a brain tumor was because of all the steroids he took. Before he died, he wrote an article for a magazine explaining exactly why he died. He died because he took steroids, and the steroids created this situation where he had cancer growth. He did it initially. He wanted women to be attracted to him, so he got bigger. Eventually, he couldn't function anymore as a male, and eventually, of course, he had the brain tumor and died. But he died in his 40s, in his early 40s, which is a tragedy. Anabolic steroids do have an impact on the user's mental state. At first, supporting more aggressive and confident behavior, but this is just in the beginning. You keep taking it, now we got a really serious problem. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. Eventually, you become quite paranoid. This emotional cycling is known as roid rage and is more pronounced in individuals who have anger issues. University of Nebraska. University of Nebraska used to have the best football team in the nation. And the reason was because they had such powerful, quick linemen. Their linemen were not only big, they were also fast. And the reason they were fast is because they took steroids. They looked like bodybuilders, not like power lifters, not like the fat guys that you see in most programs. These guys were muscular. They had slender hips, they had huge shoulders, they had gigantic chests, They had a gymnasium the size of your gym and it was full of weights, and they all lifted weights, but a lot of them took steroids. My daughter went to the University of Nebraska to get her master's degree. And while she was there, she worked at a bar and grill. She was a waitress at a bar and grill. And one night, the football team came in, and this one guy started drinking. He started drinking. He didn't have that much to drink. My daughter was feeding him alcohol, and he only had a couple drinks. But something clicked. Something happened, and all of a sudden, he tore all of his clothes off. So this guy's as big as a truck, weighs 250, 275 pounds. He's ripped. This guy is just solid muscle. He is a massive fellow. Rips all of his clothes off and goes and busts through the door. He knocked the door off its hinges, ran out of the restaurant, and started sprinting down the road. So he's running down the road naked, and of course everybody's chasing him, and half the people are laughing. And of course nobody could catch him because he's sprinting. This guy is literally sprinting, and nobody could keep up with him. Got into a residential area, and he's running down the street. A lady jogger was jogging toward him. She was about to go into her house. She was jogging with her dog. He grabbed a hold of her and started tearing her clothes off. The dog started attacking him. He grabbed a hold of the dog and crushed it with one hand, killed it with one hand. He's tearing this lady's clothes off, but of course nothing happened at that point. People were starting to arrive at that point. He grabbed a hold of her. He had torn her top off. He grabbed a hold of her, and he jammed her he slammed her head into the window of a car and busted the window of her car. I don't know if you've ever tried to break the window of a car. It's not easy. But when he did that, he gave her a concussion. Her face got cut. She had a cut on her neck. It looked like it might have cut into her jugular vein. At that point, people started trying to fight him and trying to pull her away. He fought them all off, grabbed a hold of her again, and jammed her into the second window, the back window of the car. They grabbed him again. They finally wrestled him to the ground. And of course, she's unconscious. As it turned out, he had been on steroids, and he had gone all the way to psychotic symptoms. He's still in a mental hospital. This was about 25 years ago, and has never come out of the mental hospital. The lady, he gave her a concussion. She has brain damage. The University of Nebraska paid her medical bills. The University of Nebraska is still paying his medical bills because he was using steroids. Was it supported by the athletic program? Let's pretend it wasn't. So the funny thing was, of course, the University of Nebraska has this fabulous football team. Everybody in Nebraska wears red on Saturday because that's Nebraska's colors. Everybody goes gaga over the football team. They tried to hide it, but it's really hard to hide something like a naked man running down the road and killing a dog with his bear. That was the thing that got him. It wasn't the fact that he tried to rape the woman or busted her head through the windows. It was the fact that he killed the dog with his bare hand. That's what pissed people off. The rest of it, they would have handled with no problem. It was the dead dog that bothered everybody, and that's the reason they started trying to figure out what was going on with their program. It's close enough to stop right now. Why don't we stop right here with my horrible story? And of course, my daughter, she's like 4'11". She's feeding this guy alcohol, and she was one of the people that chased him down the street.